when I started working with Noom, people started asking me, do you have to be really slim now that you work with this weight loss company? Or do you have to live healthier? Or is this really important to you now? And I always thought that I already live healthily and it's not much of a change. But the more I get into this topic of health and of these chronic diseases, that there are diabetes and so on, the more I realize how important it is and like what a big thing it is. I don't know if you're aware of this Oxford Health Society Association model, which says there are 3 main risk factors causing 4 conditions leading to 50% of deaths. I mean, you have to die of something, but you don't want to die of the healthcare-related, lifestyle-related things like smoking, bad nutrition, and no exercise, and obesity with that. So yes, it's really important for me, and also it's really rewarding for me to see in my daily life when I work with Noom how we can help people on a big scale through digital technology, helping to live better lives. And today my talk will be very anecdotic from the experience with Noom. So this healthcare topic is very broad and I could tell a lot of things, but I chose to tell you stories from Noom and from how I experience the world there. I will also use a lot of buzzwords, so you might just want to take notes and Google them later if I don't define them properly right now, but you just might want to get an overview of this area. So Noom is a startup company that was founded 7 years ago in New York City. And our development is sort of parallel to what I would say the market went through. When we started 7 years ago, there were not many smartphones and apps. And so our founders, a tech guy ex-Google and another business person, they started with software for fitness treadmills, so just what you see on those little displays. And they brought digital things to the offline world, or to the physical world. And since the guy was from Google, Artem, he knew that the Play Store would come out, and so Noom created one of the first apps in the Play Store, number 13, which we're a little bit proud of, like ever. And Google helps, ranks you higher the longer you are in the Play Store, so that has helped us to be there very early on. And we created B2C apps, so for the end users, which everyone can download on their phone right now, if you have an Android telephone. Now we also have an iPhone app, but it came much later. So one of the attributes of those apps is this huge scale. The app is available in English originally, and now also in German and 5 other languages, and so we can serve millions of people. Like 35 million people have downloaded our apps so far. And we are very proud of all the weight loss and all the healthier lives there. Nevertheless, it's software, so it's hard to explain to people, particularly German people, that they should pay for it and they cannot touch it. German people they love our app. Maybe I should explain what it does. It's a diary app where people log their food and their exercise. That's number 1, so they have to check off their list that they logged it all. Then they get explanations, they get articles, knowledge about healthy living, but in a very gamified way, like little texts or little games. They have to check them off. And the third part is they have a community of other users, anonymous, where they can talk to and inspire, share recipes, motivate, and so on. So all of that is based and refined on a concept of psychological things, behavioral psychology. You might have learned them in these classes here as well. And so, Germans love checking off their lists, and they lost lots of weight. And I, as the managing director for Europe, I'm a bit lucky that so many people lost weight and then were asked by their neighbors, what did you do? And therefore, it went on word of mouth. As I said, they didn't pay. And so, thankfully, the organizational sector, like insurance companies and also governments with laws, realized that there is a potential and they should also start looking at it. And so our new software in the B2B field was kind of triggered by these developments. In the US, you might have heard of concepts like value-based care, or also of hospitals being fined if they have to readmit patients after a certain period of time. So this means patients who do not get well enough cured and have to come back, if there are too many of them, the hospital has to pay a fine. So they are incentivized to really cure them. And the other thing, the value-based care means that the doctors don't get paid for each X-ray they do, but only for the result. So they can do whatever they want if it's legal. But if the patient is healthy at the end, they get the same amount of money. Interestingly, obviously, now they look at cheaper ways of getting people healthy, right? And so now this helps Noom getting into this field, being one of those technologies which can be used at scale. So we are not yet profitable and not even break even, but we have some pilots in the US where our app is tested in some scientific settings in those insurances. So since my topic is Europe, I will also explain what I experience here on a day-to-day basis. So the B2C app for everyone works really well, but B2B is the tricky part here. Insurance companies here are the main player in this field. There is also a law which was just passed on prevention, so that says insurances have to do more in prevention, but they are sort of the gatekeepers. They have two main interests. One is save costs, like obviously to not have deficits. The other one is attract healthy members that don't incur costs now, so that they also save costs. So yes, in a way, yes, they're interested in such technology like ours, but our preventive approach is too far down the road. If I tell them today, look, your patients will be healthier in 10 years and you will have 10% less diabetics, and one diabetic costs you 20,000 a year or whatever, 10,000, you will save millions by my technology that costs you now $50 or euros. They won't buy it for several reasons. It's risky. The people who decide today have to justify it today, but they won't be there in 10 years when someone else is praised for it. And so many reasons why this is tricky. Another big point here is the fear of bad reputation and this big word of data privacy. Like the rules are really clear in Europe, and there will be another law passed from the European Union which will apply to all European countries, not just Germany. But nevertheless, people use this argument of data and NSA to first talk about negatively about foreign companies like ours, but also to just create fear, and this blocks this process. So the result of it is that insurances now started creating their own softwares. And I don't know who of you used an app that your insurance created, but those apps are not based on nice psychological concepts and have 500 updates. There are statistics that say that 80% of insurance-based apps have 0 updates, have no reviews, and are just not used. I have posted the stats on our German blog if you're interested. So some insurances are slowly understanding that this is also not the solution, costs a lot of money, doesn't work. Then they still keep themselves busy with building infrastructure, like they have to digitalize their own processes, yes. They have to have some basic things like getting a doctor's appointment online whatsoever. So this is really basic infrastructure, really boring stuff, but they think they are doing something in digital stuff. And if you read their annual reports, that's how they describe what they're doing in there. Nevertheless, to be a bit more optimistic, there are some apps that have been approved. One of them is, for example, from Germany called Caterna, which is a program which, spelled with a C, which helps kids who have a problem with their eyesight to somehow get that better, get it right, some exercises there. The other one is from Hamburg, it's called Tinnitrax, and it helps people with tinnitus in a really smart way of filtering the music. One issue with getting approved there is that the rules of getting approved are not yet adapted to the digital age. So the processes we would, for example, as Noom have to go through is still one for drug development. So, for example, you have to have a printed manual which the customer gets with your app or with your drug, obviously. So, what app developer would do that? Or for doctors, for example, there are some telemedical services where you can interact with your doctor. If you're remote, for example, in the countryside, you can talk to your doctor who is in the big city through some sort of Skype thing, safe Skype. But there is no item on that list for doctors which they can charge. So they only get the money for telephone call, like €5 or something. So obviously they are not incentivized in doing telemedical things if they are not getting paid for it. So those are some of the issues there. But as I said, some successes already in Germany as well. As you can see, it takes quite some time. I also wanted to tell the ESCP students here who are interested in theses. What we are doing with Noom is we have randomized control trials where we use all of our data that we already have gathered, but we also set it up in a new way where we have our software versus a traditional product. And we try to prove scientifically how our product works also long term. And like obviously those studies have to be made by proper research institutes, and there are many professors who have a nice side income by apps like ours, and we don't do it, but just putting their name on a proof or saying we have done a study, okay, just for doing the study they get money. And so if anyone is planning a PhD thesis or something of substance, maybe a bachelor thesis is too small for getting a real medical outcome, but a bigger thing with a professor and a name, then I think this might be an interesting thing to do. Well, looking at the time, but I think I'll come to the last points I wanted to make. As you can see, it takes time. It takes a lot of money developing these things and getting them through, particularly if you're a startup. It's really hard doing it. So another way of approaching it is working with one of those institutes like pharma companies. I don't know if you've heard of the Bayer Grants for Apps Accelerator. That's one program that was launched a couple of years ago. Also Merck, the other pharma company, they just started one where they support startups in that field. So getting their network and experience and name tag might help getting started in such a field. And I think once we have overcome all of those legal and technical hurdles, and when we have processes there, then it gets really exciting. Like the behavior change app that an IT guy and a business guy created, Noom, is one thing, but like personal medicine, using your DNA and looking what drug is good for you, that is really exciting. And if this data can be brought together in a safe way, in a protected way one day, then I think we are not only talking about cost and that it's nice to have, but it's really going to improve the medical care of people. So if you're thinking of founding a startup like the Noom guys did, bring a lot of time and money with it, but I can tell you it's really rewarding to see the stories of the people thanking you for it. Thank you.